I am considering having an eyelid lift done. However, I have heard that it requires quite a bit of healing time. I am concerned that I may not be able to take off the time it takes to heal from eyelid surgery. How long would I have to take off of work? Are there any other alternatives to eyelid surgery that require less downtime? Thank you.
Thank you for your question. You've submitted a question without a photo, but you've expressed in your question that essentially you're interested in having an eye lift done, but you are concerned about the downtime and returning back to work, and you're looking for an alternative to an eye lift that may get you back to work sooner. Well, certainly I can share with you a lot about my perspective on this type of question, a little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. And I can tell you that you've asked a question that I focused on answering from the first day I went into practice. You see, as a specialist in eyelid surgery, my training allowed me a perspective that was a little bit different than what most general plastic surgeons experience in terms of just the style in which surgery is done. So I'll explain further. I first trained in eye surgery, in ophthalmology, surgery of the eye. And one of the things that we did routinely, of course, was intraocular surgery, surgery to remove the lens, the cataract, and then to replace the lens. This is very, very delicate surgery, and it's done under a microscope, and it's done with patients essentially awake and having to remain relatively still. So when I did my training in oculofacial plastic surgery and then additional training in facial plastic surgery, I found myself naturally inclined to ask the question, why can't we do cosmetic surgery, whether it's eyelids or facelifts and other procedures, under local anesthesia? And so what I did was essentially look at the reasons, and with the one simple goal in mind: to make the procedure safer, to make the procedure allow for quicker recovery, and allow people to get back to work sooner rather than later. From the time I went into practice, my patients have always been people who work. And regardless of their socioeconomic level, they needed to get back to work sooner rather than later. So what I can tell you is that in our practice, how I advise my patients is that we do our procedures, whether it's upper eyelid surgery or lower eyelid surgery, we do the surgeries under local anesthesia with light sedation. Now, the light sedation is very nice because it allows you to relax, but it's the alternative to having general anesthesia. For many of my colleagues in general plastic surgery or other plastic surgery specialties, prefer to do things under general anesthesia, which means there's a tube in your throat and you're paralyzed and you're put on a respirator. And that may be what they're comfortable doing, and certainly the surgeon should be comfortable. What I found that recovery from general anesthesia and just the fear of undergoing general anesthesia was a big area, an obstacle for many people to pursue cosmetic eyelid surgery. So when I started to show people that we can do this under straight local anesthesia or doing this with local anesthesia with sedation, they became much more willing to consider these procedures. Now, surgical technique, choice of procedure, approach, and then immediate aftercare is something that's also very important. And generally speaking, I would say the majority of our patients go back to work in 1 week and sometimes even less. Now, a lot depends on the type of surgery that's being done and the degree of or amount of surgery that has to be done. But as a basic rule, if it's upper eyelid surgery where we're addressing excess skin, a little bit of fat, then basically the amount of swelling can be relatively minimal. And if it's lower eyelid surgery where we typically do transconjunctival or from the inside of the eyelid um, treatment of the fat pockets, and then we do PRP and fractional CO2 laser, we still get people back to work in about a week. And it's not uncommon for our patients to come back in a week and have almost no bruising. So we've definitely mastered to a degree, to a certain significant level, the art of helping people achieve their desired cosmetic result and be able to get back to work sooner rather than later. I know that a lot of people end up not choosing cosmetic surgery procedures and choose other alternatives that try to camouflage what they're unhappy about with their eyes. And unfortunately, a lot of times the camouflaging procedures, whether they be injectables like fillers or neurotoxins, which try to compensate for these different anatomic issues, they can end up more bruised than they would with surgery. They can end up looking more swollen than they would with surgery. So that's kind of an interesting thing. In fact, we have many patients who come to us to have fillers actually removed using an enzyme called hyaluronidase to actually get rid of additional puffiness caused by, quote, non-surgical procedures. Now, I do a lot of these non-surgical procedures, so it's not like I'm against them. But if you need cosmetic eyelid surgery, then I would just inform you that it is possible to have these procedures with local anesthesia and light sedation with good quality surgical technique. You should be able to get back to normal life and work in about a week. Now, it's not the end of your healing process. The healing process is ongoing. But in a broad spectrum, in a broad strategy, I should say, I always try to explain to my patients that there is functional appearance where you can get back to work and get back to the normal aspects of your life, and then there's the cosmetic side where you're going to ultimately look your best. So we've done things like help a woman whose son was getting married in 10 days. We did her eyelid surgery and her facelift surgery, and 10 days later she was attending her son's wedding and she looked very good. Now that's a lot of pressure, and I prefer not to do that, but it just gives you a sense of what is possible. So meet with experienced qualified cosmetic surgeons who perform a lot of eyelid surgery and learn about their approach and see if you can find someone you're comfortable with who can offer you this type of scenario. So I hope that was helpful. I wish you the best of luck, and thank you for your question.